There is a lot of debate around the use of the word impingement when it comes to shoulder injuries, and I agree that a lot of times it is used when it should not be used, but there are cases where it is very clear that something is impinging in the shoulder, and I would like to illustrate this with these two cases. In this first case, we will be looking at a long axis view of the supraspinatus tendon. Here we have marked the most important anatomical structures. First we have the acromion with an acoustic shadowing under it. Here we have the humeral head with the overlying cartilage, which is anechoic. Then here this is the tendon, and within the tendon here we see two calcifications with an acoustic shadowing, because this is actually the place where you would expect to see the footprint of the supraspinatus, the greater tuberosity. But it's not to be seen because these calcifications are blocking the view. Then here I have marked also the tendon, so this is the tendon, and overlying here is the subacromial subdeltoid bursa, and here we have the deltoid muscle. So now we're going to see a dynamic movement in which the shoulder is abducted, and there we see that there are multiple calcifications, and a larger one actually comes into view while making the maneuver, and you see that this is a huge calcification impinging against the acromion. There's simply no space left for the shoulder to move, and hence this is a clear case of an impingement. And here we have a second case. Here we are looking at a long axis view of the subscapularis tendon. In this image I have marked the coracoid process, which is a hyperechoic line with under it the acoustic shadowing, of course, because we cannot look through the bone. Here we have the humeral head. This is the subscapularis tendon going towards its insertion here. This is the footprint of the tendon, so the tendon actually moves down into the enthesis right here. Here you can still see it, but here you see that it's hard to actually see the tendon and also the underlying bone. That's because there is a calcification right in this area causing the acoustic shadowing. We'll see that more clearly once the clip starts playing. One more thing to note is this bony irregularity right here, which is right between the end of the humeral head and the cartilage, and here the footprint, and in between these kind of irregularities are normal, and they are called herniation pits. Here I have also marked the tendon, which you see here, and here you see the calcification, and overlying this tendon is also the subacromial subdeltoid bursa. We're now going to make a dynamic maneuver, which in this case is an endo-rotation of the shoulder, where the subscapularis is supposed to move under the acromion, but you see because of this large calcification right here, you see there's a direct impingement between the calcification and the bone, which prohibits the arm from moving in further endo-rotation, which is again a clear case of impingement.